children are at home, their infections and their disease are less than when they are in their care centers. Because in their care centers, a large number of children are together in a very limited space. And because they want to make them busy with some work, they give them many toys. And these toys sometimes never be cleaned by those people which are with children. So toys handled by children with contaminated hands. One child contaminate toy and the other child use those toys many times, so infections very easily can transfer by displaying objects. In hospitals, there are countless vomits capable of spreading infection. Many respiratory infections are not spreading through aerosols, but rather through respiratory secretions, saliva, sputum, etc., being deposited on surfaces and hands. Sometimes one person uses his hand during coughing and sneezing. So many droplets comes to hand, and then that person shake hand people, give food to other people, give some objects to other people, so very easily can transfer infection by not directly from air, indirectly by hand or some objects. With secondary transmission via hand to mouth contact to the next host. So we remind you that sometimes animals are source of infection for transfer to humans. Some infections are related to animals, and accordingly they can be transmitted from animals to humans. So we call them as reservoirs. And those infections transmitted from animal to human we call as zoonoses or zoonotic infections. Zoonotic infection or zoonoses. Infection in the genus to animals, but naturally transmissible to humans. Humans don't transmit the disease to the others. Okay, for example, suppose a Brucella abortus is present in the milk of sheep, goats, cows, and if it is not boiled, if it is not pasteurized, it is transferred by drinking infected feed, infected milk to the people, but not transmitted from person to another person, because the route of transmission is milk, animal milk. So zoonosis, infection in the genus to animals, but naturally transmissible to humans. Humans don't transmit the disease to the others. For example, rabies. Rabies is present in some dogs. So during biting and hurting the skin of person, the virus of the rabies virus transfer from dog to human and make it in nervous system problem. but it doesn't transmit it from human to human. It is zoonosis, or it is zoonotic infection. It is a zoonotic infection. We can see some zoonotic infections. For example, some zoonotic infections are related to the viruses, like rabies, like yellow fever, viral fevers, hantavirus, influenza, West Nile virus, and so on. Okay? Bacteria, which is important according our course, because we are teaching advanced bacteriology. Bacteria like Rocky Mountain spotted fever. It is a zoonotic infection related to dogs and transmitted by ticks from dogs to human. Pesticidosis by birds. Leptospirosis, domestic animals. Anthrax, which causative agent is Bacillus anthracis. Domestic animals like cows, sheep. Brucellosis, which Brucella abortus is related to cattle, sheep, pigs, and mostly it is present in their milk. Plague related to rodents and transmitted from rodents to human by fleas. Fleas, accidentally made fleas after drinking blood from rodents come to human and transfer this disease to human. Salmonellosis, variety of mammals, birds, rodents are the source of infection, are those animals, and it is transmissible to human. Tularemia, rodents, birds, and it can transmit it from these animals by arthropods to human. And another thing like ringworms, a worm, domestic animals. Toxoplasmosis, it's a protozoan related to cats and rodents and birds. Trypanosomiasis, it is also is a protozoan. It is a protozoan like Trypanosoma cruzi, which is present in America, and it is transmitted by bug, B-U-G, bugs. And African trypanosomiasis, which Trypanosoma brucei is responsible, but it is transmitted by tessa fly. Trichinosis, which Trichinella spiralis is mostly related to the animals like swine, pigs, bears, and it can transmit it to human by eating uncooked or not well cooked meat of pigs. Tapeworms, like what? Like Taenia saginata. Taenia saginata is a zoonosis infection which cattle and swine. Taenia saginata is related to cattle, and Taenia solium is related to swine. And some tapeworms are related to fish, like the Philobutarium blatum. So cattle, Taenia saginata, swine, Taenia solium, and fish, the Philobutarium latum. are those worms. And the last one, scabies, which is another one. It is related to domestic animals and can be transmitted to human also. So zoonotic infection are those infections related to animals, but they have the possible transmission to human and can infect human. Acquisition and transmission of infectious agents. Acquisition and transmission of infectious agents. Some infections, some infectious disease we call as communicable disease. Communicable disease. What does it mean? A communicable disease is one that is spread from one person to another through a variety of ways that include. So communicable disease are those diseases which they are related to infectious disease. A microbe is responsible of the disease and it can be transmitted from one person, one human to another human. But how can transmit it? By different means, by different ways, like contact with blood and bodily fluids, breathing in airborne pathogen, or by being bitten by an insect. What can we see in this photo, in this figure? Factors involving in the chain of communicable disease transmission. When we have infectious disease, it may have a reservoir or it may not. When there is infectious disease of human, may have or may not have a reservoir, but it has susceptible host. So infectious agent can transmit it to susceptible host. How? By finding suitable route of entry and by find out the mode of transmission, by air, by flies, by biting, by many things, many routes, by food, by air, by vomits. And when it infects one person, it should find a route of exit to go out and transmit it to another susceptible host. So what are they? They are factors involved in the chain of communicable disease transmission: reservoir, infectious agent, susceptible host, route of entry, mode of transmission, route of exit. How communicable diseases spread? By different ways. They can spread from one person to another person. One way is direct contact, by touching, for example. Some microbes can easily transmit it by touching one person. So we shouldn't forget, for example, when one person is hospitalized in a clinic or in hospital, or if one person is very sick and having rest at home, as much as possible we shouldn't touch it. For example, we want to kiss him, we want to shake hands, we want to tell him you love him, you like him. So as much as possible, because those microbes which are living with you cannot make you problem because you have a normal immune system. And your normal immune system very easily can suppress them. But when one person is in the hospital or is very sick and resting at home, immune system is very weak. So very easily those microbes which are not normally problematic can start a serious disease in those people. Okay? Indirect contact. Sometimes there is sneezing or coughing. Sometimes we see some people have mask in front of nose and mouth, but during sneezing and coughing, remove it without keeping mouth and nose, directly send all aerosols in the air. So what is the mask for? They think mask is for protect them not to be infected. And we don't understand it is bidirectional. The mask is used not allowing you infecting any person and not to be infected from any person. So mask is working in bidirectional, not infecting any person and not any person infect you. Animal and insect contact. Sometimes some insects like sandfly, tessa fly, or another mites, ticks, and many ticks can bite and transfer serious infectious microbes like bugs, and sometimes some animals directly bite people like a dog. For example, when an infected dog with rabies virus bite any person, very easily transfer those viruses to the person, and those viruses attack to the central nervous system and may be life-threatening and kill the infected patient. Other contact, contaminated food and water. So food is rich of nutrients, and water is a good source for many infections. Many infections very easily can be supported in food and water and can transmit it and make one person to disease. For example, when you're eating dinner or lunch, if something is extra, you put it in the refrigerator, because if it is remaining outside, those small microbes are present there, grow and make it infected. And sometimes problems is related to the food dealers. So food dealers sometimes making the food infected with some microbes. Okay, we want to show you some communicable diseases. Name of disease like Vibrio cholera, producing the disease of cholera very easily, mostly by water and sometimes by food. It can transfer to the people. Typhoid by Salmonella typhi. Again, source of infection is food and water. Hepatitis, mostly we mean hepatitis A, which can be transferred by food and water. Influenza virus, it is transmitted by air. Tuberculosis, Mycobacterium tuberculosis, very easily can be transmitted by air. Malaria, mosquito, and tetanus, Clostridium tetani is the agent of the disease, and it can be transmitted especially to those people which are working and with any accident, any hurting to the skin, and very small amount of dust containing the spores of this bacterium can be transmitted there and growing and make a problem to the nervous system. Okay, so some important bacterial diseases like tuberculosis by the agent of Mycobacterium tuberculosis, leprosis, Mycobacterium lepera, chlorella, like the agent Vibrio cholera, parasitic disease. Some are intestinal amoebiasis. The most important amoeba is Entamoeba histolytica. As its name shows, amoeba, it is amoeba, and ant means it is anthric. It is related to the alimentary canal. It is related to the intestine. And histo means cells, histo, and lytica means lysis. So this is an amoeba which is living in alimentary canal and attacking to the cells of intestine and starting lysis those cells. So it is accompanying with some bloody diarrhea or dysentery or bloody diarrhea. Malaria, Plasmodium falciparum. So Plasmodium falciparum is one species. There are three another species also: Plasmodium vivax, Plasmodium ovale, Plasmodium malariae. All life cycles are the same, but some clinical syndromes a little may be more dangerous or less dangerous. So the most dangerous Plasmodium is Plasmodium falciparum. Filariasis, which it is a worm, especially Wolsheria bancrofti. Leishmaniasis, so we have different types of leishmaniasis, like visceral leishmaniasis or kala-azar, which Leishmania donovani, like warmest place in the body, and the warmest place in the body is reticuloendothelial cells, and it is mostly related to the liver and a spleen. So it attacked to the liver. But another leishmaniasis, like cutaneous leishmaniasis, they want to live in the coldest place of the body, and coldest place of the body is skin. So in Leishmania tropica, they remain in the skin and starting infection. Along with parasitic disease and bacterial disease, we have some viral disease like poliovirus type 1 and 2, hepatitis virus A, B, C, D, AIDS, influenza, different types of influenza, Asian influenza, bird flu, influenza A. swine influenza, swine flu, with type A, and sometimes these infections are related to the fungi, fungal disease, like fungal scalp infection, Tinea capitis, fungal foot infection, athlete's foot, Tinea pedis, fungal infection in genitals, buttocks, and inner thighs, Tinea pedis, are some examples. Some examples from many hundred, many thousands of infections which can be present and transmitted. And some of these infections are sexually transmitted disease. We call them in abbreviation STD. STD, sexually transmitted disease. And some of them are bacteria, related to the bacteria, like chlamydia trachomatis, chlamydia, like gonorrhea disease. The agent is Neisseria, gonorrhea, and syphilis is related to the Treponema pallidum, which these bacterial infections are among those important STD, and some are viral, HPV, human papillomavirus, genital warts, HIV, human immunodeficiency virus, herpes virus, and hepatitis B. And some are parasitic, like public lice, crabs, and trichomoniasis. So trichomoniasis is a flagellated protozoa. It is very easily can be transmitted in sexual intercourse and make people infected. Mostly the male people are carrier and female are reservoir. The other part we want to focus on, and little we want to have a discussion, is non-communicable infectious disease. Some infectious disease in normal cases don't have capability for transmission. Maybe I have one of these microbes, but it is not showing any disease in my body, and it cannot transmit it to another person. When my immune system is working well, and the other people around me, their immune systems are working well. So what are they? Occurs primarily when a compromised person is involved by his or her own normal microflora. Sometimes some microbes are with us without showing any disease. So some of them live in our body, receive food, but they are harmless, without any side effect, without producing any problem. But some of this microflora, when my immune system is low, when my immune system is not use signs and symptoms. So afterwards, I have something to say to the physician. Before that, not. contact with organisms in natural as opportunistic pathogens are a group of microorganisms that don't usually infect healthy hosts but produce infections in hospitals, to immunodepressed persons, or those patients presenting underlying disease as cystic fibrosis, which favors infection. So sometimes I have some microbes, they live with me without any problem, and they are alive, but they don't show any problem, and they are waiting for what? Waiting my immune system not working properly, then show their real appearance. An opportunistic infection is an infection caused by a pathogen. So some opportunistic infections are bacteria, fungi, parasites, viruses that take advantage of an opportunity not normally available. So in normal case, they don't have opportunity. But when my immune system is weak, they find this opportunity to start disease. So accordingly, we call them opportunistic infections. Opportunistic infections. These opportunities can stem from a variety of sources such as weakened immune system, as can occur in acquired immunodeficiency syndrome. For example, when one person have HIV, HIV don't kill him. HIV suppress immune system. HIV stop immune system. So maybe one real pathogen and sometimes one opportunistic pathogen, if coming to the body of one patient harboring HIV, can kill him. So most people with AIDS go to die not by HIV, they go to die by another infections. Or sometimes when being treated by immunosuppressive drugs. For example, one person kidney is not working properly. If one person has kidney failure and need an operation to receive another kidney from another person. So in order to interrupt attack of immune system to new kidney, physician give that patient some immunosuppressive drugs. So this person is very sensitive to not only real pathogens but also to all opportunistic infections. So accordingly, for many days they are in isolate room. But we like to go inside room, we like to go very close to them, we like to get his hand, we like to kiss him, but it is not correct. We can show our feeling, but in 2-3 steps far from him. We can say him how much we like him, how much we love him by phone. We can stand on the other side of window and look at and talk to him, because those microbes with you, which they are not attacking to you may kill him. Okay, so when one person using immunosuppressive drugs, we should avoid to go very close and touch him. And sometimes we take some flowers in a vase full of water. So these flowers and these waters and this vase can harboring some microbes, some spores of fungi, and they can be life-threatening. And sometimes when we bring them home, they go to bed, we put some birds in cage for singing close him. So these birds in cage containing many spores, many bacteria, and you don't help him for curing in earliest time. You make him in more problem. And as well related to the people with cancer. So immune system is in struggling cancer. So most power of immune system is going towards the cancer. So one person harboring cancer is very ready for receiving another infections such as opportunistic infections. And an altered microbiome such as disruption in gut microbiota. Sometimes when you go to trip to another city because you are far from your normal food and you are dependent mostly to restaurant and shops food, sometimes normal flora of intestine are ongoing to some changes. And it make ready for some opportunistic pathogens to show themselves. Accordingly, when you go to trips, mostly you use onion, mostly you use yogurt, and something like that to make it in balance your normal flora of intestine. And sometimes when you use antibiotics related to one disease, by antibiotics using for pathogen can kill some of the normal flora of intestine. So it is alteration of microbiome, and alteration of microbiome helping for opportunistic pathogens to show themselves and starting some extra infections, some extra problems. Or breached integumentary barriers, for example, by penetrating trauma or any accident to our skin, to our body. So the natural barrier of skin is opening and some microbes very easily can go inside. So whatever we call as normal flora, as in their normal place, they are normal flora. But our deeper tissue, our kidney, our liver, our brain, our blood are sterile. They are empty of any bacteria. But if in any case, by any trauma, by any biting, any microbe or any groups of microbes can come to the deeper part of the body, they have opportunity to make problem for the patient. Many of these pathogens don't cause disease in a healthy host that has a non-compromised immune system and can in some cases act as commensals until the balance of immune system is disrupted. So some microbes are living with us, you know, if your weight is 70 kilogram or 80 kilogram, something around 2 to 3 kilogram of your body weight is related to those microbes are living with you. So when you check your weight, 2-3 kilogram of your weight are related to those normal flora are living on your skin, in the upper respiratory tract, and mostly are related to those bacteria which are living in your intestine. And mostly, in most times during the year, most of them are friends and they don't show any problem. But if any of things happening, if the balance of immune system is not working properly, if our immune system to go and balance them can find opportunity to start infection in their place which they are living. Opportunistic infections can be attributed to pathogens that cause mild illness in healthy individuals, but lead to more serious illness when given the opportunity to take advantage of an immunocompromised host. So if a real pathogen comes to your body, sometimes they are weak. So some pathogens are weak, some pathogens are strong. If one weak pathogen comes to your body, you go through a mild disease. But if the same microbe, the same weak microbe go to the body of one patient with immunocompromised situation, may be life-threatening and it can show a serious infection. A wide variety of bacteria are involved in opportunistic infection and can cause a similarly wide range of pathologies. Partial list of opportunistic pathogens and their associated presentations include a partial, okay? Some of important ones. It is not all, but it is some of important ones. One example is Clostridium difficile. What are we talking about? We are talking about a partial list of opportunistic pathogens. Number one, Clostridium difficile. Clostridium difficile is a species of bacteria that is known to cause gastrointestinal infection and is typically associated with the hospital setting. So Clostridium difficile, not normally showing any problem, but in immunocompromised persons or in people with low immunity produce gastrointestinal infection. Mostly those people are in the hospital. Another one is Legionella pneumophila. Legionella pneumophila. Is a bacterium that causes a respiratory infection. Okay? It is an opportunistic pathogen. If finding any person with low immunity showing problem, and problem is respiratory infection. And mostly when cannot find susceptible host, they go through the protozoa and living in protozoa, and protozoa help them for continue their life and helping them for spreading in the environment. Spreading in the environment. Another example is Mycoplasma avium complex. Mycoplasma. You know, we have one bacterium with the name of Mycoplasma, which it has a great difference with another bacteria because all known bacteria have cell wall, and mostly their cell walls are composed of peptidoglycan, but Mycoplasma don't have any cell wall. So we are talking regarding to the Mycoplasma avium complex. MAC is a group of two bacteria, Mycoplasma avium and Mycoplasma intracellular, that typically they produce co-infection. They produce co-infection. Another bacterium is Mycobacterium tuberculosis. Mycobacterium tuberculosis, the agent of the disease of tuberculosis, is a species of bacteria that cause tuberculosis, a respiratory infection. Pseudomonas aeruginosa is a bacterium that can cause respiratory infections. It is frequently associated with cystic fibrosis and hospital-acquired infection. Mostly it is related to the people which they suffer fire or they have burned skin. In the people with burned skin, normally, mostly they will be infected with Pseudomonas, especially Pseudomonas aeruginosa, and especially those ones which have multiple antibiotic resistance. Multiple antibiotic resistance. Salmonella is another one, is a genus of bacteria known to cause gastrointestinal infection also. One of the most important, the other most important one is Staphylococcus aureus. Staphylococcus aureus is a bacterium known to cause skin infections and sepsis. Sepsis means the presence of bacteria, of this bacteria in the blood of the patient. And sepsis is different with bacteremia. Bacteremia is the presence of bacteria for a short time, and they suppressed and they removed by immune system. But if bacteria can resist against immune system, can remain for a long time, can grow, can multiply, and can spread in the body, then we call it is sepsis. And sepsis is a dangerous situation if there is no good consideration by physician and good antibiotics and good therapy, patient go to die after sepsis. Sepsis is very dangerous situation regarding to the patients. So Staphylococcus aureus can produce sepsis also. Notably, Staphylococcus aureus has evolved several drug-resistant strains. So some strains of this bacterium are resistant to many different antibiotics. And some of them are known as MRSA. Methicillin-resistant Staphylococcus aureus is related to those strains which are resistant to methicillin, and therapy is difficult. Therapy of infection by this bacterium is difficult. Another one is Streptococcus pneumonia. As we see the name, the species pneumonia, it is a bacterium that causes respiratory infections. Respiratory infections. Streptococcus pyogenes. Streptococcus pyogenes, also known as group A Streptococcus, is a bacterium that can cause a variety of pathologies, including impetigo and strep throat, as well as other more serious illness. Okay, so another item in continue our lecture we want to focus, and we have more explanation, is nosocomial infections. It is nosocomial infections. As I indicated a few minutes back, many microbes cannot produce any disease in our body when our immune system is working well. But in any case, when we are in the hospital, after any surgery, after any operation, after any accident, so our immune system is lower than normal case. And some infections can be present in our body with the source of hospital, which we call them nosocomial infections. Nosocomial infections. Healthcare associated infections, HAIs, occur as a result of receiving treatment for another condition. Nosocomial infections are HAIs associated with hospitals. They occur as a result of chains of transmission. For example, suppose one person has heart operation. He is in ICU or CCU, and after a few days, now some microbes attacking to the urine system, urinary system, and now he has also UTI, urinary tract infection. So why did he came to the hospital? He came to the hospital for heart operation. And when came to hospital, he didn't have urinary tract infection and received this infection from hospital. So whatever we receive, any infection we receive from hospital, we call it nosocomial infection. We call it nosocomial infection. And these infections can come from different sources in the hospital. Some of these microbes come to the patients. Bacteria from visitors and hospital workers. Yes, so when these people come very close to the patient, shake hand, get his hand, kiss him, and so on, very easily transmitted those microbes to the person. Or, for example, nurses or physicians. Physician, they are in the neighbor room. They were examining another patient. Then, without washing hand, without disinfecting hand, again coming to check this one. Again going to the third one and to the fourth one. And one nurse or one physician very easily can transmit infections from one person to many hundred another patients. And those receiving infections, receiving nosocomial infections. Some microbes can come to the patient by elevator. Some microbes can come to the person by ventilation ducts. So in ventilation ducts, if it is old system or during the years not well repairing, some and mostly ventilation ducts are they have humid situation, and in humid situation many molds, many bacteria can be present, and they can send their spores to the person. Okay. Contamination from equipment. For example, one nurse come to the patient with some equipment, wants to check blood pressure, wants to check the body temperature, and so on. Wants to check the blood sugar. So use this device during the day many hundred times. If not disinfecting properly, very easily can be transferred to the another person, or those plates, whatever giving to the patient, should be disinfected. Sometimes window is open and many bacteria very easily can come inside, and some of them may be pathogenic or maybe have the possibility to make the patient in second infection or second problem. From surgical procedures, equipment, personnel, and exposure to drug-resistant microorganisms are those things that are very important regarding nosocomial infections. More than 1/3 of nosocomial infections could be prevented if physicians of hygiene rules. For example, in US, 2 to 4 million cases per year get nosocomial infections. So 4 million people go to hospital for another work and get nosocomial infection. Approximately 90,000 deaths are related. So 90,000 people in US to die, not according to real problem. So person came for heart operation and now he was going to die according sepsis of bacteria, for example, nosocomial infection. So heart problem was big problem, but he didn't go to die according heart operation, but went to die according nosocomial infection. Most common organisms involved are gram-negative intestinal flora, gram-negative intestinal flora, because all people during the day, during the week, many times going to toilets, and some of them hands are infected with gram-negative intestinal flora, and on the other hand, some people, especially some ladies' nails are long, and after going to toilet, never some of them cleaning their nails very properly. When nail is full of bacteria, very easily can be transmitted. But when transmitted to people with normal immune system, we cannot feel the transmission. But when it transmitted to one person in hospital or one person with low immune system, he will die, and mostly that person cannot understand he killed him. Okay? E. coli and Pseudomonas and Staphylococcus are the most important ones. They are the most important ones. Okay, so we are in the page of 64. If there is any question, please ask me. If not, next week we can go and continue page 64. Please remind me next week. Is it anything? If there is anything, please tell me. If not, we can stop at this point. Okay, thank you very much. Hope the best. See you soon. Goodbye.